Hi, this is Dr. Richard Ruling, here to share with you the great news of how you can break addictions, whether it be to smoking, alcohol, caffeine, foods, negative lifestyles one way or the other can shorten our life and ruin our happiness. And I'm just here to share with you, I had experience at the University of Arizona in Tucson while I was taking internal medicine, helped with a stop smoking program, 5-day plan. And on the 5th night, about 100 plus people raised their hand they had not smoked in the previous 24 hours. This was about 2/3, 70% of the people. There were about 150, 60 people in the course. And the others, I believe, could make it if they stayed with the program a little longer, because we offered yesterday an outline of what we call New Start: nutrition, exercise, water, and it's an acronym for sunlight, temperance, and we're going to focus on that today. Air, breathing exercises, and rest, and trust in God. And you can be successful if you use these tips that we're sharing with you. Look back over yesterday's part 2 if you didn't see it. And we're going to explore today how drugs, medicines can adversely affect us in this process of becoming free from addictions. And really, there's the top 5 leading causes of death are impacted by these addictions. And we'll review basically. We think, for example, that heart disease is number 1. It's not number 1 in this country. It is drugs and prescription drugs, adverse drug reactions. Just in a quick survey, the JAMA, Journal of American Medical Association, reported 106,000 deaths in 1998 on tax day, April 15. Okay, it was in hospitals, and the definition of an adverse drug reaction is properly prescribed and administered. Wasn't a bad prescription. It was commonly prescribed for that condition, and not overdose either. Took the right amounts. And my former wife, who did that with a bladder infection, took an antibiotic for 3 days, didn't need it any longer, but months later had an adverse drug reaction to something that went into her system because it was the only drug she took. And the physician's desk reference says that Cipro can cause platelet disorders. Her doctor referred her to a hematologist who put her in the hospital, did a bone marrow, no platelets in the bone marrow, and took out her spleen, still no better, treated her with high steroids and transfusions till she died of a stroke. I remarried, happily so, for 14 years now, a woman, RN, whose former husband died of the same antibiotic. This is more dangerous than you realize. If you never hear about it, you think, oh, that's rare. Well, it's a lying CDC that never reports the adverse drug reactions, even though the Journal of American Medical Association said it was the 4th to 6th leading cause. 2 years later, the Western Journal of Medicine reported 199,000 outpatients outside the hospital. And if you put those two together, it's 305,000, and medical care is number 3 in terms of heart disease, cancer being 1 and 2, supposedly. Okay, well, one more study from 1998 to 2005, and this was reported in the Archives of Internal Medicine, and it said that the serious diseases reactions were 2.6-fold, and deaths increased 2.7-fold. If you multiply 305,000 times 2.7, you get 824,000 deaths. And medical care, adverse reactions, is number 1. Okay, so people don't know it, but stay away from medical doctors that don't know anything but drugs. Okay, I wasn't trained in natural remedies. Sometimes chiropractors can tell you about diet and things like that better than doctors do. Okay, so but I'm going to tomorrow share it with you, a link, an opportunity for a video that's excellent, how you can reverse most diseases without prescription drugs by eating. But that's not our topic today. We're talking about temperance or abstemiousness, abstaining from harmful things that can do it, and the drugs are the main deal. We've been talking about tobacco, but it can be alcohol, caffeine, etc. I'm going to share with you just a quick perspective. The 5 leading causes of death, from my perspective right now, are heart disease. Medical care, number 1, heart disease, number 2, cancer, number 3, lung problems, especially for smokers, is number 4. Stroke and accidents are also there, related to accidents related to alcohol or also mind-influencing drugs. And then strokes, which is caused by high blood pressure. Primarily, that's the main risk factor. And high blood pressure can come from too much alcohol because it makes the blood sticky. Also caffeine. Caffeine makes your heart pump faster, blood pressure goes up. It wears off as the caffeine wears off, but if you have another cup of coffee later, or have a Coke or something, it can again stimulate you with the caffeine. By the way, caffeine also stimulates the stomach acid. It causes all kinds of GERD, gastroesophageal reflux disease. It causes increased acidity in the stomach and trouble that way, ulcers, peptic ulcer, etc. So, but the number one thing that we're not seeing, though it was in the lead article of the New England Journal, that's one of the leading journals in this country, it was 1981, March 11, I believe it was, that the relationship between coffee drinking and cancer of the pancreas, which is the number 4 cancer death. Cancer, number 1 cause of cancer death is lung cancer, okay? And if you smoke, get rid of that. That's one thing you don't want. Even if you took an x-ray every 6 months, most of those people will still die of lung cancer within 5 years, okay? It just can't pick up the cancer early enough, and the bronchogenic carcinoma is not sensitive to radiation or chemotherapy. So bad news if you're going to smoke. And so you can quit now, and let's look at the other things that it can do to you. Also, by the way, prostate cancer is a factor, and caffeine can be a factor in that because and breast cancer, by the way, too. Caffeine creates fibrocystic breast disease, and that's a risk factor for breast cancer. So anyway, long story short, we're just looking at a lifestyle where we use substances, and if you smoke, I had a mayor in a little town of Southwest City, Missouri, who said he's tried many different ways of quitting, and this was easier than all the others, because if you drink caffeine and your nerves go out the roof, you need a smoke to calm them down. And if you try to quit smoking and you're just drinking caffeine, it's almost impossible. So leave out the caffeine, leave out the alcohol, do it for these 5 days. You'll find that you can manage and get over the hump. And usually about 3 days you're at the peak. 4th day is a little better, and 5th day is significantly better if you will do the things we're talking about, including eat lightly for the first couple days, fruit juices, things like that, vegetables if you need something more substantial, but not a heavy diet of hamburger, steak, or high dessert foods, rich, etc. Don't do that. You need blood in your brain for willpower, not down in your stomach to digest everything you're eating. You need a detox, basically. So this will help you, and what we're saying here on the drugs is applicable not just to smoking, but to avoiding the main cancers and heart attacks, etc. Okay, I think we've covered it pretty well. I want to suggest support for what you're doing with this book, Health, Happiness, and Destiny Come from Wise Choices. I wrote this book, and it has 5-star reviews by Grady Harp, top 100 Hall of Fame reviewer for Amazon. And he said, splendid book. He gave it 5 stars. And if you go to my website, which is also by this title, Health, Happiness, write out the word and destiny.com. Health, Happiness, and Destiny.com. And the book in digital form is just I think it's probably $4.95, something like that. So anybody can afford that if you really want it. It's less than half the price of a carton of cigarettes, and I'm suggesting that instead of buying another carton, buy the book and read it, and you'll be blessed with help to live better. Health comes from obedience to the health laws. Dr. Breslow of UCLA found that 7 simple health habits were good for a 10-year advantage on the average, but a 35-year advantage for people who broke all the rules were shorter, and those who observed all 7 rules had outlived those who broke all the rules by about 35 years. And really, they're summarized pretty well here with fresh air, sunshine, exercise, proper diet. And by the way, that his study was done way back at UCLA before the Framingham study on cholesterol came out. So it didn't even address high cholesterol, and yet still a huge advantage. I'm 83 and in great health because I've done it right most of my life, and I want to encourage you that you can do the same. So give it a serious effort, and if you break over, you know, a little child learning to walk will fall down numerous times, but he doesn't say, "Oh, I quit, I can't do it." No, they get up, they try it again, and you can too. I want to tell you, don't have any cigarettes around handy. Get rid of your packs, take your carton back to the store, whatever, get your money back, and buy a good book that will support you from Health, Happiness, and Destiny. And by the way, when you buy it in the digital form, you will get a link to a high-value video. It has Cleveland Clinic cardiologist Dr. Esselstyn, and showing how that most diseases are reversible without drugs. So do it, and you will be better off, I guarantee you. And thank you for taking the time. We'll see you again tomorrow, where we talk more about diet. And if you've got the link, in the meantime, you'll know what we're talking about. Thank you. Bye-bye.